The U.S. healthcare industry has become a massive money-making scam. And in today's video, we're going to show the statistics that prove it. The United States spends more on healthcare per person than any other country in the entire world. And even though we are the most medicated population on the planet, we're also one of the sickest. Amongst developed countries, we have the worst life expectancy and the highest infant mortality, despite having to pay the highest prices for healthcare services by far. While millions of Americans are drowning in medical debt, big pharmaceutical corporations are recording billions of dollars of profits every year. But the quality of the healthcare that the U.S. population receives in return is rather quite poor. Right now, healthcare bills cause more bankruptcies than anything else does. Millions of people are afraid to go to the hospital because they know that even a short visit could result in a gigantic financial burden that could devastate them for decades. Meanwhile, rates of cancer, heart disease, and diabetes continue to rise all over the nation. Considering the gigantic piles of money we shell out for healthcare, we should have the greatest system in the entire world, but we definitely don't. And this is a major indication that something has gone horribly wrong. The U.S. healthcare statistics that we're about to report are simply stunning. But before checking this list, please don't forget to support us by leaving a thumbs up in this video and subscribing to our channel so you don't miss our upcoming lists. Without further ado, here are 20 U.S. healthcare statistics that will absolutely astonish you. 1. According to Brookings data, spending on healthcare in the United States has grown steadily over the past 2 decades, rising from $2,900 per person in 1980 to $11,200 per person in 2020, marking a staggering 290% increase. Part of the reason for this alarming growth is the aging of the U.S. population and the worsening of underlying health conditions such as obesity and diabetes over time, which consequently resulted in higher healthcare expenditures. 2. The United States spends more on healthcare as a share of the economy than other large advanced economies. For instance, last year, healthcare spending accounted for about 18% of U.S. GDP, while in Germany it only represented 11.2% of GDP, and in the UK, approximately 9.6%. 3. The United States has dramatically higher healthcare prices than other advanced economies. This includes diagnostic tests, prescriptions, and almost any other type of healthcare service. For instance, a Humira pen costs 16% less in South Africa and 35% less in Germany compared to the U.S. average price. But high U.S. prices are not just about higher medication prices. The United States also has higher prices for outpatient procedures like colonoscopies, MRIs, and cardiac catheterization, and hospital procedures like C-sections and bypass surgeries. For example, a hip replacement surgery is 21% more expensive in the US than in Holland and 64% more expensive in the US than in Australia. 4. Other developed nations spend 50% less on healthcare than the US, according to the Health System Tracker. In the 26 developed nations tracked by OECD, the average yearly amount citizens spend on healthcare is $5,697, while in the U.S., the average amount U.S. citizens spend on healthcare is $10,966. 5. But what do Americans get for their additional healthcare spending? Not much at all. In America, life expectancy at birth is the lowest among developed countries, while maternal and infant mortality are the highest. 6. On top of that, life expectancy in the U.S. is 77 years, while it ranges from 80.7 to 83.9 in 10 other high-income countries. And only 91.4% of the population in the U.S. has health insurance, compared to 99% to 100% of the population in other industrialized countries. 7. According to data compiled by healthcostcrisis.org, more than 48 million people in the U.S. can't afford their prescriptions every year. This means that almost 1 in 4 Americans forego needed prescription medication due to high costs. With drug companies charging increasingly higher prices with each passing year, fewer Americans will be able to afford the drugs they need. 8. Estimates released by the Centers for Medicare and Medicaid Services indicated that spending on prescription drugs is estimated to grow at an annual average of 6.1% over the next 5 years. 9. Over the past 24 months, 21% of adults aged 18 to 64 have not undergone a medical test or treatment that was recommended by a doctor. 32% have postponed getting the medical care they need, and 40% have relied on home remedies or over-the-counter drugs instead of going to a doctor, all because of the cost, as revealed in a survey conducted by the Kaiser Family Foundation for the New York Times. 10. Each year, approximately 57 million Americans are forced to cut back on household spending to pay for health care or medicine. Even with employer health coverage, a family earning $45,000 a year must budget at least 20% of their income for health expenses, including premiums and out-of-pocket costs. 11. Health spending per person is growing 2 times faster than household income. Since 1990, family incomes rose on average by 155%, while healthcare costs per individual jumped by a shocking 366%. 12. At the same time, hospital prices have skyrocketed 600% since 1990. 13. Today, healthcare is the fastest growing industry in America. In 2021, the U.S. healthcare industry was worth $714.5 billion. At least 5 healthcare providers recorded profits of over $100 billion last year. These include the United Health Group, recording a profit of $201 billion in 2021, CVS Health, $184.7 billion, AmerisourceBergen, $153.1 billion, Cardinal Health, $129.9 billion, and Express Scripts, $100 billion. 14. With all that said, there's no wonder why 41% of U.S. adults have problems paying medical bills, while 20% don't have the means to access needed health care at all, according to a report from the Commonwealth Fund. On top of that, at least 43.4% of adult Americans are inadequately insured. 15. Unexpected medical bills account for more than 60% of the personal bankruptcies in America, according to a report published in the American Journal of Medicine. 16. The report also highlights that the average age of people who go through a medical bankruptcy is 44.9 years. And while the average monthly household income of a medical bankruptcy filer is $2,586 a month, the average debt for households that experience medical bankruptcy is $44,622. 17. Medical debt is a growing financial burden for millions of Americans, with more than 1 in 3 U.S. adults carrying a balance, according to a 2021 Healthcare.com survey. The survey suggests that people in the United States owe at least $195 billion in medical debt, with approximately 16 million owing over $1,000 in medical debt and 3 million people owing a medical debt of more than $10,000. 18. All in all, roughly 60% of U.S. adults have had medical debt at some point in their life. That's probably why 65% of Americans list unexpected medical expenses as their top financial concern. 19. By 2040, the average cost of a hospital stay will be 3 times the average cost of a new car. According to West Health estimates, we can expect the cost of a hospital stay to reach $135,000 by 2040. 20. National health spending is estimated to reach $6 trillion by 2027. The annual growth rate is projected to be 5.7%. Currently, healthcare expenses in the U.S. represent 18.1% of GDP. It's expected to reach 20.4% over the next 5 years. With each passing year, health bureaucrats, greedy corporations get increasingly richer with the demise of the U.S. healthcare system, while the rest of us go broke trying to pay for our healthcare. Over the past 3 decades, Americans had to face an absurd rise in medical bills and deal with insane levels of medical debt. According to estimates released by the Kaiser Family Foundation, in 2021 alone, 70% of Americans with medical bills had to lower their spending on food to avoid bankruptcy, while 59% had to dig into their savings, using most or all of it to cover an unexpected health expense. 41% were forced to take a second job to be able to pay their debt, and 37% had to borrow money. Rather than doing something to address the abuses of the health insurance and pharmaceutical corporations over the past 2 decades, U.S. politicians have actually come up with policies that gave these companies even more power. Under the current policies, our healthcare costs will go up even faster, and the quality of healthcare services will continue to go down. Right now, the healthcare system in the United States is so broken that it probably cannot be repaired. The entire structure needs to be dismantled and completely reinvented if we want to see actual improvement. But considering that the wealthy bureaucrats are pretty comfortable with their billion-dollar profits, most of us won't likely see such a change happening in the U.S. healthcare system in our lifetime. What do you think? Let's see your comments underneath this video. Please subscribe to our channel, and thank you very much for watching.